the general manager here at Body Motion Physical Therapy, and she is currently the Allison that you see on the screen. So welcome to this workshop, 5 mistakes moms make after C-sections that could save them years of pain. So we are talking all things C-sections. If you have any specific questions, feel free to post it in the chat or so just feel free to post it in the chat. We also, at the end of this webinar, you can sign up for a complimentary discovery visit, and we are happy to talk with you about any personal information that you want to discuss with one of our doctors, any questions, any concerns, kind of your own starting points. Everybody's going to have a different story. And so, whatever is right for your specific body is going to be individual. So I'll go over some really general information here today and talk about some important starting places, but it's not the end all be all. And, if you meet with one of our doctors, they might tell you to start with something else based on your particular situation. But this is pretty general guidance of what we give people to start their healing post C-section. So, and then one shout out before I actually get to the next slide. I'm going to tell you a story from this book, but this is the book I wrote. It's called Restore Your Body After Kids, The Secret to Avoid Peeing Your Pants and Achy Joints as You Age. And in this book, there's a whole section on cesarean birth and also on having a VBAC. And so if you're interested in that, we're happy to send you a copy. You can send us an email, or Devin will drop into the chat where to send that email or your information if you want further information. So here we go. All right, so today we're going to cover the effects of abdominal surgery on the body and what that actually means for you specifically and your recovery. Then we'll talk about 5 mistakes that people make after cesarean births that we see most frequently. We'll talk about common post-op issues that occur after cesarean birth, and we'll also talk about how to prevent those issues. Great. Okay, this is the core. My little chat button has gone away, like completely gone. So, let's see. There's our chat. Okay, perfect, beautiful. Okay, so what you see here is the core. So the core is this beautiful, magical thing that consists of muscles, and it's not just our 6-pack ab muscles. This isn't just your pelvic floor. The core is actually a container that is your diaphragm, which is the very top you see here. Diaphragm, you have your transverse abdominis, you have your multifidi muscle, which are these little back muscles, and then you have your pelvic floor. This creates a container. It's like a soda can, okay? When you have this is what our core should be, this like really good pressure, amazing, you can't squish a soda can that doesn't have, that hasn't been opened yet. And so the front of the front is the abdominal wall, bottom is the pelvic floor, top is diaphragm, back is those multifidi muscles and butt muscles. And so during pregnancy, our core expands and we lose a lot of the strength that we normally would have with the internal pressure. So if this is your core, what happens with pregnancy, what happens with delivery, especially cesarean birth, is that you lose your normal pressure. So it's like I pop the top to the can, and now all of a sudden I can squish my can, okay? So all of a sudden the pressure that makes the core really strong is depleted and gone. So recovery after birth, regardless of cesarean or vaginal birth, it's really important to restore that internal pressure. That is where a lot of the core strength comes from. And that's not necessarily something that you're just going to learn in an exercise program. So we're going to talk a little bit about that today. When you have a cesarean birth, the disadvantage is that 7 layers of your abdominal wall, so let's pretend this is the abdominal wall, 7 layers are actually cut open and then stitched together. And so when that happens, not only is the can lost its integrity and pressure support from the pregnancy itself, but now we're dealing with scar tissue that's going to limit the ability for the organs to move and for the core to contract. So I like to say that the core is a really strong force absorber. So when your foot hits the ground, if you're running or just even just walking or pushing a stroller, the minute your foot hits the ground, the forces come up through your body and are absorbed in your core. Now, if your core is weak and depleted, most of the time postpartum, what happens is our body experience those forces very much more. So where it takes a toll more on the joints. There's a lot of things that can happen. And our body can compensate beautifully for a few years. So a lot of people that have births, regardless of cesarean or vaginal births, the body compensates. So if we don't restore the core the way that it should restore, and we'll talk about what that looks like, if we don't restore the core post-birth, then we end up with a lot of these compensation patterns that we can get away with for a very, very long time, but they end up causing a lot of issues. So I'm going to dive into the next slide here. So this is the core. Questions, drop it in the chart. I love this to be interactive. If you're willing to be brave and ask any questions, I'm definitely here for that. So before I go into these mistakes here, I'm just going to tell you a story. This is a really common story. So if you have just had a baby, it's awesome that you're even in tune to get here today. And a lot of times we end up seeing people that have cesarean births, and usually we don't see them until they're maybe A, hoping to have a VBAC, or B, they have had their cesarean 5 or 10 years ago. And so one of our, a client I had, she's given me permission to share her story, and she's a seriously brave mother. And she came to us when her daughter was 11. So she was 11 years postpartum, post cesarean. And she was kind of your typical what shows up at compensation. So she had leg pain, which was diagnosed as sciatic pain. So sciatic nerve pain. She had leg pain. And she had gone to therapist after therapist trying to get this pain better, and nothing was working. People told her she had to lose weight. She was doing yoga every day. And what ended up happening is that for 11 years, she just hasn't been activating her core. And so, you might be taught to know how to work your abdominal wall, but which is like those ab muscles. But that's just a little teeny piece of the core. And with the scar through the core, it's hard to activate those muscles appropriately and in coordination. So when muscles after a C-section, you have to retrain these muscles and learn a specific coordination pattern to help restore your core strength. And so this mom had gone through a lot of pain, couldn't even work. And she also had painful periods, urinary urgency. So she felt like she had to pee all the time. Sex wasn't great. And with a little bit of restoring her core and kind of looking at the right pieces, releasing her abdominal scar tissue from the cesarean birth, and then releasing her pelvic floor and retraining her entire core, she was able to walk again. She's working. She worked for a while after she gave birth, and now she's sailing around the world with her husband and daughter. And so it's those stories that I want to share. And I'm going to share some more as we go along, because it's really important that it's not standard for you to just get a referral to a pelvic expert physical therapist after you have a cesarean birth, but it absolutely should be. And most of the time, because it's not, people end up dealing with issues in the years to come. So that is what I want to talk about today. The first mistake that we see a lot of people make is that they go back to the gym right away. This is regardless of cesarean birth or pelvic floor, or a vaginal birth. So if you haven't restored your deep, deep core muscles and you start going back to the gym right away, what ends up happening is that you just don't have your core support. So your joints take up a ton more of the forces. In 5 years, that could look like knee pain or hip pain. But really, the number one thing that needs to happen when you think you're going to start getting back into exercise is take some time, take a few weeks. I'm going to repeat like a million times. You'll be so sick of this by the end of it, but you should see a pelvic expert physical therapist to really help analyze what's happening in the body. And help release that abdominal scar. So if you've had a birth, and as long as you're 6 to 8 weeks afterwards, everything is healed fine, nothing is open or infected, you can start touching that scar and moving that scar around. And you'll at least be moving the superficial layers of that scar. There are 7 layers of scar tissue that need to be moving. And when and they're all important. When you do your own scar massage, it's easy to get to like the first and second layer, but it's harder to get to those deeper layers. And it's also important to address the pelvic floor. So you might not think that. That's another slide. I'll get there. Um, so, so we're talking about going to the gym. So there's two things I want to teach you on this slide before, even if you're going to the gym, it's not too late to start integrating these things into your practice. The first thing is if you go ahead and put your hands on your belly and you have one hand on your chest. When you breathe in, you might notice that you breathe higher up into your chest. After a cesarean birth, especially, you want to work on bringing that air all the way down. So you're almost stretching your scar with every inhale from the inside. So inhaling, diaphragm, which is the top of the core, drops down, and exhale, diaphragm comes back to resting. Inhale, diaphragm drops down. It's stretching the scar, pulling the air all the way down to wherever your scar is, and then exhaling, letting it come back up, the air. And so that is a really good technique, just simply breathing, doing some diaphragmatic breathing. You maybe have heard of this before. I'm going to take this a step further right now and talk to you about the other thing that I want you to start imagining when you're doing that breathing. I say start with 5 minutes a day at least. And that breathing will help start moving the scar from the inside out. The other thing that you should think about when you are doing that kind of breath is your pelvic floor. So your pelvic floor, anus, vagina, urethra, clitoris, okay? Your pelvic floor encompasses all those openings and encompasses those structures. And what happens when you inhale is that the pelvic floor naturally opens some. After a cesarean birth, the pelvic floor can frequently, what we see clinically, this actually isn't necessarily in the research, it's starting to come up a little bit, but what's happening in the pelvic floor after a cesarean birth, or actually any abdominal surgery, so maybe you've had your appendix out or anything like that, what happens at the pelvic floor is it elevates, it gets tighter. And when it's tight like that, it doesn't function as well. So that's why you end up with things like painful intercourse or inability to hold the urine. And that might not happen right away. They might be things that the body is compensating for that doesn't happen for a year or 2 or 5 or 10. And so these are just things to be aware of and why it's important to start thinking about your pelvic floor was affected too. And it's a really important piece of the core. So with your inhale, we're back to the exercise that's along with this slide. Your inhale is you are pulling the air into belly. So you're stretching that scar. And then I want you to think about, with the inhale, you think about opening your vagina or opening your anus, and that's going to help relax the pelvic floor. So if you have a hard time feeling that, you could insert a finger into the vagina and just feel the opening, or you can kind of connect to your sit bones on a chair and feel your pelvic floor open that way. So feel your anus like it's flaring open. So every inhale, anus opens, vagina opens, exhale, you get some natural recoil. So that is what I wanted to teach you as far as like the very, very first step to rebuilding your core. This is pretty much essentially where we start after every single abdominal surgery, including C-section. It is absolutely essential there. Does that make sense? Anyone want to type into the chat? Say that was clear, yes, no, talk about that further. Okay, awesome. Thank you so much, Ashley. Okay, cool. So let's go to the next slide together here. So mistake number 2 is simply, I had a C-section and my pelvic floor wasn't affected. So I hear this all the time. And all I can say is that's incorrect. And your pelvic floor is so affected. So some people that birth experience going into labor. So they might have been in labor for a while. Maybe baby even was coming through birth canal already. So that initially can cause some micro tearing of the pelvic floor or some stretching of the pelvic floor, even if the baby didn't come through your vagina. So number 1, that's how it's affected there. And the reason that's important is because if you have any tearing through that muscle, it just makes it harder for you to learn how to contract and relax that muscle. Usually anytime there's freezing, tearing, adhesions within the muscles, it makes it impossible, not impossible, but very difficult for them to fully contract as a muscle and fully relax. A healthy muscle is able to fully contract, relax, and bulge. So we need all those positions. And so that's the first way the pelvic floor can be affected. But as I touched on the previous slide, anytime the abdominal wall is sliced open and then stitched back together, there is tightness. So within the pelvic floor, I'm going to stand up here and I want you to pretend like I have a really, really cute swimsuit on, a one piece, if you will. And if I tighten here and I'm say this is where my C-section is, I'm tightened here, this ends up, a scar ends up pulling every which way. So you can see it's pulling from up here, it's pulling from down here, and internally the same thing is happening. And so you get this massive pull, a fascial pull, if you will, across your entire body. So this is why the C-section itself can be responsible for things like neck pain, because you're getting things, your fascia is actually pulling from here, or shoulder pain. So my leotard isn't letting me reach up all the way that it should, or my swimsuit. So does that make sense? Does that make sense? If you have an abdominal scar, just type into the chat that yes, you can kind of see how that's connected, how the fascia is impacted, and how the pelvic floor is also impacted. Hopefully that's clear. And if you need me to repeat any of that, I can definitely do that. Yeah, it is so interesting and it's so important. So I'm going to talk to you about one more layer of so if we're talking pelvic floor, talking about the fascia, and the reason it's so important to deal with the scar tissue and start to retrain these muscles is also the very last cut that they do is the hysterectomy part. So it's not necessarily removal, but it's just the cut into the actual uterus that happens. And so there's actually a scar in the uterus that occurs, which is usually a vertical scar when they take the baby out of the uterus. And so when they're cut into the actual organ, that organ freezes in your body. It has to heal. And it's really big when they cut into it, right? So we all know that after you have a baby, you can still have contractions because your uterus is shrinking down. And so with that, you're left with a little scar or a big scar inside the uterus, and the uterus freezes in the body with that scar. And naturally, what we want to have happen, a healthy, happy, beautiful uterus, ebbs and flows and moves in the body. And then every time your core contracts, the uterus moves more because you are contracting your muscles, and your organs kind of squeeze together when the core contracts, and then the muscles relax and the organs get to ebb and flow and move in your body. That's what's responsible for good, healthy bowel movements. That's what's responsible for pain-free menstrual periods. So menstrual cycle, throughout the menstrual cycle, pain-free menstrual. So you don't have menstrual cramps, is pretty much if your uterus is moving and ebbing and flowing beautifully, and your ovaries and your fallopian tubes are doing the same thing. This is also independent of your breath. All your organs should be moving. And when they are doing that, they're healthy and happy. And the pressure inside your core is great. But if you have a cut through your uterus, things tend to freeze down, and they can cause a pull on your colon. So a lot of times constipation is really common. They find that 10 to 15 years after a cesarean or any abdominal surgery, bowel obstructions can happen because the scar tissue just gets so tight, the organs get tight, and then you can get actual kinks in the bowel, which is crazy. And another reason that they should just refer, every single person who has a cesarean birth really deserves so much to have pelvic floor expert therapy addressing the abdominal scar and addressing the pelvic floor for these reasons alone. It's also common that we see at that 10-year mark, painful periods, and really painful and really heavy bleeding. And clinically, what we think is happening is that there's just, the uterus is literally frozen. And so to fluff the lining of the uterus every month, it just takes extra cramping, extra contraction. So that's really, I got distracted, but that's what's happening. So as far as pelvic floor and the pelvic organs, it is all very connected. It is all very, anytime there's a cesarean birth, your pelvic floor is just epically affected. I mean, that's why even if you have a cesarean birth, you're in the same boat of not having intercourse for 6 to 8 weeks. Not saying that you're ready to go back at 6 to 8 weeks, but it's because that whole pelvic bowl, this whole pelvis is, excuse me, is still very much affected. Awesome. Okay. So mistake number 3 is that I don't have any issues, pain, incontinence, etc. And I had a cesarean birth. This is usually what we see, 8 to 12 weeks. It's like, okay, yeah, it was really awful in the beginning. No one told me it was going to be that bad, but now I'm breathing. Now I can go through life and I actually feel okay. And so this is kind of like what we see. And I think it's a huge reason, other than for it not just to be standard practice to see somebody after birth. The reason that we see these soliloquies play out 5-10 years later after birth. So with this slide, we talked about diaphragmatic breathing in the very first slide. With this slide, I just want to emphasize that one of the most important things, even if you have zero issues to deal with postpartum, to deal with after cesarean, is to get that scar moving, and not just superficially where people teach you to move just your scar, because the scar is so much deeper than that. And that's why my personal opinion is that it just takes somebody else doing it for you. It's really hard to mobilize the entirety of the scar by yourself because honestly, it's not that comfortable. And it's hard to inflict discomfort on you. And so on yourself. So that is one of the things to really deal with. The reason being is that scar, I'm going to go back to the core slide. That scar cuts through one of the most essential core muscles that I'm going to teach you how to use right now. And most people after cesarean birth go many years. Here's the arrows. Oh, here we go. Go many years without using this muscle. And that is the transverse abdominis muscle. So as you can see, it connects all the way down onto the pubic bone. And so when there's a cut through this muscle, it pretty much paralyzes the muscle. And some people get some activation back, or have, can feel it contract on the right side and feel it contract on the left. But it's really hard to get the muscle contracting when there's still scar tissue in there, because so a contraction looks like this, relaxation looks like this. If it's scarred down right here and it's only contracting a little bit, you're just not creating the full power and getting all the pressure that needs to happen in order to create that really strong core. So hopefully that makes a little bit of sense. The next part of the puzzle, so to get this muscle firing, the very first thing I can teach you, other than breathing, so you have to have your breath first, because that's going to help open things up. Now we're going to talk about contracting and getting some of that contraction pressure back. So your transverse abdominis is this muscle that sits under your six-pack ab muscle, sits underneath your obliques on the side here. And if you imagine that right at the top of your pubic bone, so right down here, you have your bladder, and you want to think about, you also will feel your two hip bones right here, the two hip bones right here. This muscle is going to contract and pull those together. So if you put your hands there and then you do a shh sound or an SH sound, so shh, you should start to gently feel that muscle contract. So when I'm shushing, I feel my transverse abdominis. For me, I'm pregnant, so I feel it lift up the baby. But I feel that muscle contract on both sides of my hips here and let it go. And I feel it relax. So contracts it and then relaxes it. So that is the general gist of how to have a transverse abdominal contraction. Now, it's important that you are contracting that muscle and it's not your obliques working, or it's not your six-pack ab muscles working. And so that's just some of the gist. If that's painful or uncomfortable, definitely get some help. But even if you're like, I'm unsure what I'm doing, I would still say, like, make sure that you know what you're doing, because this is one of the most essential muscles that you need working for you your entire life. And it's really not fair that after a cesarean that it doesn't just come back on, unfortunately. We know, like, as far as anyone in the medical field that does like any knee surgeries or hip surgeries, The minute you cut into a joint, you lose the muscle, the natural muscle connection around that joint. And so you go to physical therapy to retrain those muscles. That's just like standard practice. Most surgeons won't even do the surgery unless you commit to like, yes, I will go, to physical therapy afterwards. And so the same is absolutely true for cesarean birth. And so I just want to put that out there. At Body Motion, we really emphasize getting the organs moving, getting the scar tissue reduced, and then retraining the core, and also really taking an in-depth look at the pelvic floor because it is so affected. Okay. We are on the next one here. I can't see my whole screen, so. Okay, this is a great one. One of the things that we hear a lot is I want to wait until I'm done having cesarean, or done having kids until I address these issues. And like I told you before, the body is beautiful at compensating. That's why we can go years and years and years with certain alignments and postures and not have pain until 10, 15, 20 years later. So addressing it sooner is going to really help take care of the scar tissue. The longer that scar tissue is there and not dealt with, it's just going to get tighter and tighter and tighter. When we see people post cesarean and they're like 6 to 8 weeks after birth, usually we can, if it's just one cesarean, one abdominal surgery, usually we can get their scars moving within, and get everything, their core beautifully put back together, I want to say, but functioning at its most optimal level around 12 visits. When we start seeing people with multiple births that have a lot of scarring, it just can take a lot longer than that. Now anything is better than nothing, but I highly recommend, like, even if it's one visit that you can have, you have to have it, because you have to know how to utilize these muscles, because it's going to save you so much money down the line. It's going to save you so much years of discomfort. My passion behind Body Motion, I'm tangenting here, is just the fact that like women deserve, people who have babies deserve postpartum care so much, because if we're not restoring our cores after babies, then we are wearing out our joints. And so we will be the parents at 50, 60 having joint replacements. And then that joint replacement only addressed the pain and not like the root cause of the dysfunction. And so you just keep having this pattern that wears out another joint. And then maybe you're in diapers because you never address the like real root cause of the issue. And so I just am so passionate about everybody getting the care that they need. And if you deal with it postpartum, you can just avoid the soliloquy of events that happen down the line. So, okay. And then if you had a baby, most of the time, if you don't have this feeling, more power to you. It's such a challenge, but it's so hard not to feel this way, not to just want your body back. And so you start some intense routine. And like I said before, if you're starting an intense routine or have issues, initially, it's, or you don't have issues, but you have scar tissue and your core is not working for you, then you're just going to end up with these compensation patterns. And although you might start to feel okay, for a while, there's just always going to be something that just doesn't feel quite right. So if you have that feeling like you're just like, something doesn't feel right after this birth, or I don't feel, it just feels a little off, then listen to that, listen to that inside your body, and listen to that inside your brain. If you're just a few weeks postpartum, sometimes it's hard to have the wherewithal to actually listen to that and do anything about that. But the more that you can gift yourself in actually taking the time to heal, recover, and build your core, the better your whole entire life is going to be. And I full-heartedly see that every single day as I work in this practice. So perfect. Any questions about those mistakes that we see? Is that helpful information? Anyone wanting anything else, more info, or wish I touched on something a little bit deeper? Just throw it into the chat if you would. Perfect. So here's some common issues that we see post-cesarean. And again, this could be right away, but this could be 5 to 10 years down the line. And so I can't see my slides. Okay, pain in the scar, would be the first one. So if you have pain or numbness in the scar, or it just does feel different, then some nerves were affected, and we can absolutely get that tissue moving. The sooner you do it, the better, because the more the nerves can regenerate. Nerves regenerate at 1 millimeter a day, and as long as they're facilitated to do so. So there is definite hope for that, getting you some normal sensation. Constipation is a big one. Constipation really might be like the number one cause of issues in the pelvis. And the reason for that is having constipation can really increase the pressure within the soda can and can really take its toll on the core. And so then the core isn't working effectively. It's like if I sealed the can again, but I blew it up, the core would just not be able to move and would not be able to absorb forces. So, and eventually it would explode. That was drastic. But really that, like, what happens with constipation is that we want to get all of that moving. The healthier your colon, your uterus moves and flows in your body, the better your core is going to be. And so constipation is clinically diagnosed at having a bowel movement less. So every 4 days is considered constipation, but really a healthy, happy colon is having a bowel movement, and easy to pass bowel movement every single day. So dyspareunia is painful intercourse. We find this frequently after cesarean birth. Sometimes it's with deeper thrusting. Sometimes it's just with insertion that you'll have discomfort. And so definitely recommend getting this addressed as soon as possible, especially any of the pelvic floor issues. If you address them before you go through menopause, it's easier because you have the hormones on your side to help support the tissue. So you'll still have estrogen, you'll still have all that good stuff that's really going to help keep those muscles healthy and hydrated, and it helps the whole pelvis heal better and your core heal faster. So but if you're postmenopausal, it's still absolutely possible. It just takes a little bit more time. So incontinence, so fecal or urinary, so losing stool or poop or gas, and also losing urine when you don't want to be. So it could just be like you pooped a little in your pants and you didn't know it, or you did feel it. And, a lot of people feel embarrassment about this, but this is really common injuries that can occur after a cesarean birth, even though you don't necessarily think of it because a baby didn't come through the birth canal. It can still very much be there. Knee pain, this is a lot of times the compensation patterns that happen over time. And then recurrent muscle strains, ankle sprains, back pain, neck pain, shoulder pain. These are all different things that can happen after cesarean. So if you're having any of these, I highly recommend getting an appointment or getting a consultation. And Devin so nicely just put that in the chat here. So how to heal, the very first thing is start the breathing that we talked about today. Breathe so deep. Learn to breathe into your pelvic floor. Breathe into your scar so you're really starting to move it. There is nothing more powerful that you can do. And then also learn how to contract your transverse abdominis muscle that we talked about today, using that shh pattern. If you can truly isolate that muscle so you can contract it without using your pelvic floor, without using your inner thighs, without using your obliques, then you are really going to start healing your core. You want that muscle to drive a lot of your movement. When that muscle is also firing appropriately, it's going to help hold your bladder in place, and it's going to help keep support of your pelvic organs. Perfect. And then, yeah. And so that's really how you'll begin to heal and rebuild. So as far as like what we do specifically, the very first thing we do is we identify we identify the scar. We see what's happening in the pelvic floor. So we typically do this through an intravaginal examination. So here we'll, have gloves, and we're checking all these layers of the pelvic floor. So this is just the first layer that you see here. If I take this off, which this is a new model for me, so there we go. The second layer is on the back side of this, and it's more of a fascial layer. And then the third layer is these deep muscles here. And so they're all affected, and they also should be addressed. along with your abdominal wall. And then we heal those structures. So that's the next step. We spend time putting pressure. Sometimes people might call it massage, putting, pressure on the scar, helping the scar rebuild. So if you massage it, you break up that scar tissue, and then new collagen can lay down and rebuild healthy tissue that can contract and relax. So, and that's within the pelvic floor and within the actual abdominal wall. I'm going to just interrupt myself here to talk a little bit about VBAC. So if you're hoping to have vaginal delivery in the future, this is something that if you can address it before you get pregnant, the better that will be. But if not, there is so much you can do to really help facilitate the pelvic floor opening. Again, another thing that I really just should be absolute standard of practice is that the pelvic floor is teaching the pelvic floor to open, and not just by cues, but actually assisting it and stretching those muscles to prepare for a baby coming through the pelvis. It's just absolutely essential. And, our rates of C-section in the US are like, there's 1 million C-sections a year is the last stat I read. In a lot of hospitals, the average is about 30% C-section rate. In the Pacific Northwest, we're a little bit below that, but some hospitals are actually above that. So those are really, really high rates for this massive abdominal surgery that's going to affect you your whole entire life. And so, heal. I just want you to heal after this. And if you're hoping to have a VBAC, then absolutely learning how to control that pelvic floor. And really, we don't just teach that to VBAC clients. That's really what I'm talking about as far as healing your entire core as well, is, learning how to use your pelvic floor, teaching your pelvic floor to go to the positions that it should. And then we start retraining these muscles. So I talk a lot about releasing and opening them, but then we also have to learn how to contract them and how to build them back up. And we don't do this through Kegels, just so you know. That is, you might think we're a pelvic expert physical therapist, but we actually believe more in the anti-Kegel approach. The anti-Kegel diet is usually what I'm putting all my patients on. And it's really because most people are walking around with their pelvic floors so contracted that they don't need to be Kegeling. And then that's just increasing the pressure in their abdominal, in their whole core system, not allowing them to use their core. And so work on retraining that. Once we retrain the core, this step 4, rebuilding the body, once your core is working for you, is when it's like, go back to the HIIT classes, go back to the gym. You can run safely as long as your core is actively working and firing for you. So that step 4 phase is usually where people jump to right away. And I'm going to tell you honestly, after my first birth, I was absolutely that person too. And you end up paying the price later on. So take the time to go through step 1 through 3, and then you'll get to step 4. And then a lot of times there's maintenance required to keep our core strong as well. We get our cores back after pregnancy or birth, and there's just some maintenance required. And you can do a lot of that just by changing your daily habits of how you use certain muscles that become second nature. And then step 6 is progress and performance. So if you're training for something new or really starting to push yourself for, like, say, a marathon or a birth, that's where maybe you would ramp up your work with a pelvic expert again, just to make sure that your pelvis and your whole entire core is keeping up with your increase in function or increase in movement. So these are just some of the references. But I would love if anyone wanted to ask any questions here. We'll go back to that previous page or question page here. Happy to have you type in the chat, and I can answer anything specific. I don't know how to allow anyone to talk, but I thank you for joining me today, and I hope you learned something from this webinar, and I wish you the absolute best healing. But all right. Feel free to drop any questions in. Andrea, we're happy to send you a copy of this webinar. So it is recording, and we can get you a copy of that too, so you can catch the first part. Awesome. Cool. Thank you guys so much. All right. I hope you enjoy the lovely sunny weather we're supposed to have tomorrow and today. So, all right. Happy weekend. Take care, everybody.